I'm Tareq Nabhan, an emerging vision scientist and an assistant clinical professor in the College of Optometry at the University of Missouri, St. Louis. My research focus has a few arms. One arm rests on developing hardware-software solutions adapted to mobile processing devices. One such tool is a system and method that allows for determining shape, power, thickness, structure, function, and composition characteristics of the cornea and/or tear film layers. Another tool currently in development guides the determination of refractive parameters of the eye using image processing and computer vision algorithms in real time. These tools enable both synchronous and asynchronous telehealth and teleeducation applications. A second arm rests on developing 3D extended reality tools that have the potential to democratize clinical education globally. I'm currently developing an interactive 3D slit lamp biomicroscope wherein true-to-life representations allow for an interactive user interface with degrees of freedom matching a real slit lamp. Virtual manipulation of slit lamp features via free space hand gestures would result in changes observed on virtual and/or augmented case presentations. Not surprisingly, progress has been interrupted due to COVID-19. However, in any situation, we must look for opportunity and assume the responsibility. While serving on our university's COVID-19 reopening task force and focusing on clinic reopening, scaling, patient and exam sequence flow strategies, we realized certain eye exam procedures may carry more risk than benefit in the age of pandemic. One such procedure is non-contact tonometry, also known as the air puff test. This is arguably the most common tool used to measure eye pressure. Working in partnership with the Department of Computer Science, we began thinking about how to best image and measure tear film splatter and aerosolization potential. Encouragingly, Peng Wu et al. Showed that 1/3 of patients with COVID-19 had ocular abnormalities. Additionally, Lu Chen et al. Published a case report of a hospitalized patient confirmed with 2019 novel coronavirus disease and found viral RNA particles in moderate amounts in conjunctival swabs. Note that saliva samples seem to trend with ocular viral loads. That's a scary thought when considering the urgency of the global masking guidelines meant to reduce viral transmission. In 1991, Britt et al. Showed tear film splatter with NCT use in the age of HIV/AIDS pandemic. However, the investigators were unable to demonstrate aerosolization of the tear film in eyes not receiving topical drops due to limited imaging tools at the time. They summarized that air puff tonometry may not be aseptic as once thought and that further studies were needed to clarify the issue. And so our objective became clear. We want to determine if modern air puff tonometers aerosolize the tear film by using novel image processing and computer vision algorithms to perform the analysis. We've since prepared a white paper describing our project, submitted our protocol to IRB for testing at our University Eye Center, and identified matching NEI funding opportunity announcement mechanisms. The financial costs of this pandemic has resulted in a national deficit in the order of trillions of dollars. We are not immune to this and believe that the results of our project could help guide both ophthalmologic and optometric best practices in the age of pandemic globally.